We've got the thyroid that is there to kind of rev up our body appropriately and give our bodies the ability to utilize energy. Pregnancy and childbirth can change the symptoms a woman has afterwards. So she might not have the cramps as badly. She might be able to, they might be worse. I mean, some people's hormones are off enough that they might be worse. If you really want to rest and you can't rest, you might be a little shorter with people. You might be a little irritated. So I give you all permission to rest when you need to rest. I know that a lot of people want to know more about women's hormones because we all go through our stuff. So I'm Dr. Lisa Gordon, and I'm affectionately known as the fairy godmother of chiropractic and wellness. I've been in practice for 37 years as a chiropractor, and I've added lots of other technologies and techniques to my practice because I just want to offer the most comprehensive and best health care that I can to the community. And I particularly love working with women who are going through these changes of life. And I also work with other people. Today I had a little boy who had autism come in, and I've got men coming in, and I've got teenagers coming in. I've got all kinds of people coming in for various things, for allergies and for hormonal stuff and for just life and health challenges in general. I probably have something that can help most people. So today we're going to be talking about women's hormones. I'm going to kind of start from the beginning, and I want to define what hormones are. They are chemical signaling molecules which carry messages to and from the cells in the organs. So the hormonal system is made up of endocrine organs. You may have heard the word endocrine, like you might have an endocrinologist if you happen to have a thyroid problem. Or you may know that the endocrine organs, the endocrine glands or organs, are the thing that, the system that helps us to handle the chemical aspects of our bodies. So I'm just going to draw this out because I know we're talking about women's hormones. There are many different endocrine glands. The organs that are of the hormonal system happen to be called glands. So maybe you've heard that you've got swollen glands, or you have a thyroid gland. So the lymph system, the swollen glands, that's not quite the same thing. But what we're talking about are the ovaries. Well, we know we have ovaries, right, as opposed to men who have testicles, and those are kind of the bottom end of the hormonal system. And so it goes like this. We've got two organs in our brain. Well, we've got three actually. This is called the pineal. This is the one that you want to cover at night because when it's dark, you can sleep better. And that actually, the pineal gland actually sees through your skin in a sense, and that's where the melatonin is made. So maybe you've heard of melatonin that you may or may not take. I don't suggest taking it all the time, but sometimes it's helpful to help you go to sleep. But you can also just make sure your room is completely dark, and you can even cover that up, and that'll help for your body to make more melatonin. So that's one thing. That's not necessarily the female hormones, although all females have them. So we've got that. We've got the pituitary gland, and we've got the hypothalamus. So this is all in the brain. All that's in the brain. Then we have a neck, and we have a thyroid gland. Thyroid gland. So a lot of women go through menopause, go through perimenopause. At various times in our lives, our metabolism might slow down. We might gain weight. We might be constipated. We might have dry skin. On the other end, that's a too low of a thyroid. So the thyroid isn't functioning as well as it should. The other thing that might happen, and you might even know people who have this, somebody who can't sleep. Somebody who's really skinny and their metabolism is super high and they're kind of hyper. That would be hyper, too much thyroid. So I'm going to come back to this. Then we've got the adrenal glands down here, but we've also got the pancreas. So the pancreas is considered one of the endocrine organs, although it hasn't always been considered one, but it is because it puts out insulin. So insulin is one of the hormones that affect how we handle sugar. The liver is also involved in that. So the pancreas is on the left side. Let's pretend this is the right side. The liver is over here. And that has a lot to do with this system as well, because when people have high cholesterol, it's really because their liver isn't working well. And when people have imbalances in their female hormones, like in their estrogen, some people end up with breast cancer. Some people end up with cysts in their breasts, cysts in their ovaries or their uterus. Those are imbalances in the estrogen of the body. So those people may end up gaining weight a lot. They just might not feel that well. They might end up with hot flashes if that system is not in good shape. And that can happen, it usually happens at the end of the menstrual period, and we'll go over that in a minute. But it most often is associated with menopause. So women who all of a sudden can't sleep because they're sweating at night, they might have hot flashes. Those of you who have had them know that they are miserable. And as a result of that, they may get irritable. So everybody, a lot of people say women get irritable during their period, or they get irritable before and during their period. They might get irritable when they're going through menopause. They might get brain fog at any of those things. So we're going to come back to irritability. I've got really fun things to say about that. Okay. Really, I do. Okay, so we've got the hypothalamus, the pituitary, and the pineal in the brain. We've got the thyroid that is there to kind of rev up our body appropriately and give our bodies the ability to utilize energy. And then we've got the liver and the pancreas. Those are handling blood sugar. And then we've got adrenals. A lot of people know about adrenal fatigue. So our lives are chaotic. Most of our lives are chaotic. We don't rest enough. We have too much input. We've got, these days, way too much input. So our adrenal glands are the parts of our body that give out cortisol. They give out the hormones that help us to handle stress. And then we've got ovaries or testicles. We're going to talk about ovaries because we're here talking about women's hormones. If I were talking about men's hormones, I would talk more about the testosterone and so on. Although women have some testosterone, we're supposed to have some testosterone. Everybody has all of those hormones. We've got estrogen in men and women in various balance. So estrogen, progesterone, and testosterone are the main sex hormones that we know about, that we typically know about. And then it gets much more complicated, but it's not that useful to get more complicated. And if you want to get more complicated, then you can either look it up or you can have a conversation with me and I can share what I know. So in this system, we need to have good communication. It's not enough to have each of these organs or these glands to put out enough of their hormone. It's not enough for the thyroid to put out enough of the thytrophin, the thyroid hormone. There are many of those hormones in the thyroid. If the thyroid gets tired, it's going to come up here and tell the pituitary that it's tired, and the pituitary is going to send more stimulation to the thyroid. You may have had some lab work done, and somebody might have said your TSH is high. That's a thyroid stimulating hormone. It's not a thyroid hormone. It's a pituitary hormone. So this communication is essential. And then the thyroid, once it gets more stimulation, it can put out more of what's called T4, which has to turn into T3 in order to be useful in the body. So our cells cannot use T4, but they need T3. So here you got a T, and you've got a molecule, and it has some T's on it. So this is the molecule, and there's the T's on it. So if it has 4 of those hormones on it, those hormone molecules, the body can't use it. So the body has to take one off. So that has to be taken off by the body effectively. And if it isn't, then the body's still tired. So the cells cannot function the way they should. So this is a whole conversation about what if you need thyroid medication, which one is best for you, and so on. And that's a conversation that I can have with anyone individually. I'm not a medical doctor. I don't prescribe thyroid medication, although I do take it because I have been hypothyroid for over 30 years. So if I knew what I know now, I might have been able to nip it in the bud and not end up with a thyroid that probably isn't working much at all because it's dependent upon the medication. So I do have some patients who could go one way or another, and a lot of times they choose to go more natural route. So they end up feeling better, they can sleep better, their menstruation goes better, their menopause goes better, they just feel better overall, they have energy, and they can think. So those are kind of the things that we end up with in terms of symptoms. The ovaries, so the hypothalamus and pituitary are also responsible for some of the estrogen, and a large part of the estrogen is made in the ovaries. Not all of it, but part of it. So we've got all these different things are making different hormones. And if they're in balance, then we go through our life just fine. Some people will say, oh, it's really natural. It's normal to have menstrual cramps. Well, it means something's out of balance. I'm going to come back to this because this is really important. We've got some younger women in here, and I know some of us have already gone through the whole process of perimenopause and menopause. But for those of you younger women, and it's interesting for those of us who have already been through it to know this too, because this is some good advice. So I read a book a long time ago, and it was called Circle of Stones. It was one of the best books I've ever read. I don't even know if it's in print anymore. But in this book, it explained so well how women, when we get our periods, should rest. You're tired. You're a little more tired. You want a little more quiet time. But in our culture, we don't give ourselves that. There's nobody to take care of the business. There's nobody to take care of the family. There's nobody to take care of the stuff that needs to happen. There's nobody to get gas in the car. Whatever it is, we have to do all of the stuff. And we don't give ourselves a break. In olden times, there was a tradition of the women who were menstruating getting taken care of by the other women in the village. So the other women in the village would take care of the woman's family. They would take care of her jobs. Whatever she needed to get done, people would pitch in, and she could rest. So they would just take care of her. They would take care of everything. And the lesson that I took from that is that when we don't do that, we get irritated because we really want to rest. And it might happen to you on a regular basis. If you really want to rest and you can't rest, you might be a little shorter with people. You might be a little irritated. So those might be lessons for you to take when you need that space, when you need that time to take a bath, to take a nice leisurely walk by yourself or with someone you want to go with. Just to rest. Watch a movie. Whatever you can do to rejuvenate, meditate. Whatever you can do to rejuvenate, you can do. And know that that's real. That's not you being picky. That's not you not carrying your weight. That's not what it is. And I think in our culture we sometimes feel that way. So I give you all permission to rest when you need to rest.
One question. Is there a test or something that can tell you what is deficient or was wrong with all of those things?
There are blood tests that people can do that are hormonally related.
Okay.
Yeah, there are. I was going to talk about bioavailable bioidentical hormones. So a lot of people will get those blood tests done, and several people asked about this, so I'm answering a question that several people have asked. And they might find that they're low in testosterone. So if a woman is low in testosterone, she might be less vital. Well, if a man in particular is low in testosterone, he might really lose his vitality. A woman also might lose her sparkle a little bit. So she might go and say, oh, hormone doctor, sure, I'll take these things, and she'll be fine. She'll feel way better for a few months, and then she'll crash. So in my world, my philosophy is medicine and surgery are a last resort. Let's go with as much natural as we can. And I'm going to give you some information about an anti-inflammatory diet. So if you can decrease the inflammation in your body, if you can just take care of yourself in certain ways, and if you can take certain supplements that we can find out about. In my practice, what I do is I find out what each individual person needs in terms of the supplements, and then we get together regularly so that we can gradually improve a woman's hormonal life, digestive life, immune system life, whatever it is, neurological, whatever it is that a person needs to get back into balance. Sometimes you can do some of that on your own, and sometimes it's useful to know that someone like me exists that can help you. So that's what I wanted to say about irritability. I'm just going to go through these stages and what to expect in each stage. So in prepubescence, that's when a child is born, she has all the eggs she'll ever have. She'll never have any more eggs. And when they run out, that's when menopause happens. So that's why some of us, when we start going through menopause, we might have a period 1 month and then skip one and then have one the next month. And it might be every other month for a few months or a year or whatever. And that's because the left ovary is not done yet and the right one is. So when we have a period, it happens because the egg comes down from the ovary into the fallopian tube and goes into the uterus. And if there's pregnancy, then it'll implant and it'll become an embryo. So the odd times that we have periods during menopause, it's not that odd if you know that this happens. So if things are out of balance, however, you might shed the lining of the uterus, and that's what a period is. It's a non-implantation of an egg, so nothing's there that the uterus needs to handle or keep. So the body, in its intelligence, sheds the uterine lining, and that's the blood that comes out at your period. So the hormone levels at birth are very high. They decrease within a few months, and then they remain low until puberty. So here we are at puberty, and these little girls, these girls who are starting their periods, might have mood changes. They might have differences in their way of going about things. They may have some brain fog. They may not really know what's going on. I mean, if we think back, can we imagine what it must be like to be a little kid, and then all of a sudden all this weird stuff is happening, and all of a sudden you feel different and kind of freaky, and you might get irritated. All right, puberty. In early puberty, the hormones do increase, and so now they're going to be differentiating into different hormones that are useful to that person at that time of her life. Physical changes, maturation of the reproductive organs and breasts, and her first period. So she could get headaches, she could get uterine cramps, anxiety, food cravings, irritability, bloating, breast tenderness, and these symptoms, of course, as we all know, have changed for all of us, I'm sure. Fecundity, that's the time of life when a woman can get pregnant. So eventually the hormones settle down and a woman can know a little bit more about what to expect during her periods and her monthly cycles. And again, those are triggered by the release of the egg into the fallopian tube and then into the uterus, which doesn't need it, so it sheds that, and that's your period. And pregnancy and childbirth can affect the way a woman has her period, so not the way, but her symptoms. So pregnancy and childbirth can change the symptoms a woman has afterwards. So she might not have the cramps as badly. She might be able to, they might be worse. I mean, some people's hormones are off enough that they might be worse. And so things can change. And the body is always having to go back into some kind of balance. So after pregnancy, some of you might have experienced some mood changes that were not how you usually are. You know, now you've got this baby and you should be happy, and you might not be able to be happy. You might have some depression. Now, postpartum depression can occur because the hormones aren't going back to any kind of normal yet. And in my practice, I have also found that scars on the body that are from the birth, for instance, if the woman had a C-section, or if she tore vaginally, or if she had an episiotomy, those scars themselves can cause postpartum depression if they don't heal. And so they can affect the nervous system. So that's one of the really amazing things that I've seen in my practice. Once we start handling those scars, the depression lifts. And people can be depressed, women can be depressed for years and years after they've had the baby. You know, you think that, oh, now I should be happy, my child is in sports, and my child, you know, and my life is great, and they're still feeling down and depressed. And it could actually be the remainders of the postpartum depression because the hormones never got back into balance. So we can handle some of that stuff. That it's not necessary to go into the bioidentical. They're not identical. They are not the hormones from your body. The only things that are the hormones from your body are the hormones from your body. Anything else is artificial. So what we like to do is find out which of these glands is tired and not be able to do its job, and provide it the nutrition specifically or the stimulation that it needs by other non-nutritive supplements that are a little bit more advanced. But I know that I have a lot of patients that are on them, and they're wonderful. Sometimes the liver needs to be able to clear the estrogen, clear the hormones, so that the body cannot have a liver that's overloaded. If the liver is overloaded, then the cholesterol is going to get high, and women and men can have a fatty liver, and that can be a really, really big problem because the liver has at least 700 functions. So the liver and then even the gallbladder can have a lot to do with the thyroid. The thyroid has a lot to do with the adrenals. There's something called the hypothalamus pituitary adrenal axis. So HPA axis. So all of these need to be in good communication with each other, and they need to be able to support each other. It's kind of like a community inside you. And everybody needs to cooperate. And if somebody's hurting, then that one needs to get some attention. So it's kind of like a community in there. Perimenopause is when the changes in the hormones begin that are going to lead to not having enough, the eggs come down anymore. It has something to do with our age, and our bodies are so innately intelligent that we don't have to wait until we stop producing eggs to have these changes start occurring. So perimenopause can begin earlier than you think. It can start around age 38 or 40. So when we start seeing women who are feeling different from how they used to feel, maybe their libido is changing, maybe their brain is getting a little foggy. They're not necessarily going into Alzheimer's, but they're having some hormonal shifts that their body and their brain need to get used to or attended to. That's when the night sweats could occur, difficulty sleeping, hot flashes, vaginal dryness, variations in mood, brain fog, Some people have this prickling sensation on their body, or eczema even, dry skin, changes in energy level, and there can be other things. Some people get migraines. Perimenopause typically lasts 2 to 8 years. So then, I know, it can be brutal if you don't understand it and you don't take care of yourself. So, and then the people around you get affected. It's so good to understand some of these things, and we can start being gentler with ourselves, and we can start being gentler with the people in our lives and ask for their forgiveness if we feel a little foggy or if we lash out or something, and can explain to the people in our lives that I'm going through this thing and please forgive me for lashing out, and reconnecting with the people who are meaningful in our lives. It's very important. Menopause officially begins 12 months after a woman's last period. So I kind of feel sorry for the women who come in here and say, I didn't have a period for 8 months and then it came again. So it's like you have to start over. But that doesn't really mean anything, because it's just a measuring tape. There's no definite way that any particular woman is going to go through that. Now, if you have gone through menopause and then you're bleeding again years later, that's a trip to the gynecologist, because they're going to want to rule out ovarian and uterine cancer. So you shouldn't bleed. Once your period stops, you shouldn't be bleeding anymore. And the ovaries actually shrivel up and can't even be seen oftentimes on ultrasound. I was one of those people who did bleed a little bit, and so I went in and they had to do a horrible test, and they were doing ultrasound and they couldn't even find my ovaries. This was about 15 years after my last period. So the lower progesterone, there's a decrease in estrogen and in progesterone. Now this is super important, you guys. Young women, older women, all of us. You can lose in postmenopause an average of 25% of your bone mass by age 60 due to the loss of estrogen. The loss of estrogen can also result in a higher risk for coronary artery disease. So anyway, there are supplements that you can take that will actually build bone. The medications that people take for osteoporosis keep bad bone. They don't make good bone. I'm interested in you making good bone. And not every calcium is the same. It's not just calcium that you need. You need a lot more. This is a supplement company that I love and use, Standard Process. They happen to have a bone health pack. I have a few patients on it. I had one patient who had osteopenia, but moving toward osteoporosis. So osteopenia is the word they use for whatever the level is for osteoporosis. It's osteoporosis. You're losing bone. So she had on her DEXA scan, which is the X-ray thing that they use to measure this bone density. She had lost enough of her bone that she was almost considered osteoporotic, to have osteoporosis. And she took this, I think it was this whole pack, yeah, and went back and got her DEXA scan done, and she didn't even have osteopenia. So it is possible to improve, if you get the right supplements and eat the right diet and really take care of yourself, get the right exercise. There are many parts of this. You can actually build your bone back. So that's very hopeful, because one of my main interests is keeping people from breaking their hips. Mm-hmm. So I don't want my patients falling. I want my patients to have good balance, and I want my patients to not break. And I want to not break.
Was that tested with the bone density, or how do you know that that's bad? That you don't have it, or it's going
The DEXA scan is a medical test that's done, DEXA scan, and it's so easy to get done. You lie down, and they put I think you even have your own regular clothes on unless there's some metal there. And then they just do a little x-ray, like if I'm lying down, like this, through your hip, and like this through your lumbar spine. And that's it. And they get an indication as to the health of your bones. And I recommend that people get this as a baseline at some point, because then you can see if there's some degeneration of your bone. So I think this is one of the most important things about, as we get older, what to know about. I think it's the most important thing to know about as we get older. So, and then in terms of the heart, the cardiovascular, that's something that needs to be looked after too. And as much as I'm kind of resistant to going to medical doctors, I do admit that they are very, very useful when they're very, very useful. And I think this is a time when they're very, very useful. So would I take medication if I didn't have to? Or would I look at natural ways of handling things? For me, I would look at natural ways of handling things before I took medication that might have side effects and might kind of cause me to need another medication, and that's kind of a rabbit hole that I'm not really willing to go down if I can avoid it. So when you eat a meal, it's a good idea to have approximately 40% veggies, 30% protein, 10 to 15% carbs, which could be the carbs that you think about, like rice and potatoes and things like that, or it could just be more vegetables. It could be squash, it could be more starchy vegetables, and you don't need to have the starches, and then 15 to 20% fats. So we do need good fats in our diet. The fats and the proteins and the vegetables are all going to be really helpful for reducing inflammation in the body. When the body is inflamed, it's more easily out of balance. So somebody knows the answer to this. What's the worst thing that's going to inflame your body?
Stress.
Somebody said it, sugar. Sugar and stress. Yeah, sugar and stress. Right. So those are the things that you want to reduce. Some people can't have any sugar at all. They can't even have fruit without their body going into the blood sugar being too high, and then their A1C on the labs goes high, and then they're risking diabetes. Some people can have fruit. The best fruit to have is berries. Berries are really good. Bananas and mangoes occasionally, but not that often, because they're in pineapple, because they're higher in sugar. But if you want to eat those things, you can balance it by having some protein. So you could have some nuts with it, which have some good fats also. So if you want to have the carbohydrates, having protein and fat with it is a great idea, because it will protect your body from going into hyperinsulinemia, so having too much insulin, having too much blood sugar. And then, because then when that drops, when you have high blood sugar, because it felt so good to eat that brownie because you were mad at your boss, and you wanted to have a brownie, so you're grumble, 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 or you're mad about something. So you go and have that brownie, but without any protein or anything with it, and you feel better, but pretty soon you drop again, and you could get into a cycle of, oh, now I need to feel good again. And that, to me, sounds a lot like an addiction. So watch yourself and see if you're using food that way, and see if you can have a glass of water, take a walk, ask yourself if tell yourself you can see in half an hour if you still want it. Those kinds of strategies. I don't mean be mean to yourself. I mean take care of yourself. And sugar really is. A handout here about how to maximize your health at every age. Foods to eat to ease cramps. Getting enough calcium and magnesium, vitamin D, good fats, and iron are important during your menstrual years. Dark chocolate, that's the best news I gave you tonight. Dark chocolate is good. Yogurt, salmon, broccoli, pumpkin seeds, eggs, nuts, bananas, but there again, if you can have the sugar, you can have that. Chamomile tea is very nice. So if you really learned a little bit about wanting to take care of yourself because you need that quiet time, A cup of chamomile tea can be very relaxing if you can arrange to have quiet time for yourself. Dark leafy greens are also good. Oats are good. Ginger is good. All right. Drinking lots of water actually prevents your body from retaining water. So some people say, I can't drink more water. I'm going to pee all day long. Well, your body is going to start absorbing the water. Sometimes if you're drinking a lot of water and your cells don't let it come in, yeah, you pee all day. But if you drink enough and your body starts understanding that the cells need to take that water in, then you won't have to pee as much. Does that make sense? And then there are raspberry tea leaf. Raspberry leaf tea helps tone the uterus and the pelvic muscles. So for those of you who are still having periods, or for those of you who have people around you who are still having periods, get a box of raspberry leaf tea. So raspberry leaf tea helps tone the uterus and the pelvic muscles, so get some of that. In terms of working out during your period or doing heavy sports, when a girl has her period, a girl or a woman has her period, she's more likely to injure her tendons and ligaments. So oftentimes, women who play soccer, play sports that are quite vigorous, and basketball and gymnastics and whatever they are, can get injured more easily because the tendons and ligaments are more at risk during that time. I don't really know what to do about that when somebody's in a competitive sport, but it's good to know about it. Magnesium helps with both cramps, and during pregnancy it can help with morning sickness, fatigue, constipation, etc. Then we've got what a lot of people call PCOS, PCOS. When women's hormones are out of balance, she can get something called PCOS. It affects, it causes cysts on the ovaries. It causes, it is involved with, I don't know which causes what, but oftentimes there are blood sugar problems, so some of those people end up with prediabetes, diabetes. And there are some ideas here, like eating a 95% whole food diet, focusing on vegetables, nuts, seeds, legumes, and leafy greens. Eliminating processed foods and sugar is particularly important when the body has gone so far as to have cysts either in the breasts, in the uterus, in the ovaries. And then she probably needs iron-rich food because she might have very, very heavy periods and she might be deficient in iron. Again, that's something that can be tested by blood tests, and I can test also whether somebody needs an iron supplement. In terms of working out, when somebody has her period, or when she's going through a time in her life, whether it's perimenopause, menopause, the workouts, instead of being highly vigorous, could sometimes be much more relaxing. If somebody, for instance, has adrenal fatigue, she should not be doing vigorous workouts. It's not going to help her. It's going to wear her out. But yoga is great. Pilates is great. Walks, slower things, dancing are really good. If a woman has her period, she should not do certain yoga poses like the plow. Do you agree?
Mm-hmm.
We have a yoga instructor here. So you want the blood to come out, not to go back in. Think about it that way. And it wouldn't go back in. But, it's you're working with the body's intelligence. Soy is actually, if you can get soy in its natural state and it's not GMO, which is almost impossible to get, but soy by itself has some phytoestrogen properties. So, in other words, it has estrogen that's useful to the body in low enough amounts. It's just really important to have that be as clean as possible. And with our food supply, I talk about this in another talk, but our food supply is really not that great. A lot of things have been genetically modified, which can affect our DNA. It can a lot of the amount of glyphosate or Roundup that's used on our wheat is really the biggest problem with the wheat in this country, in addition to the GMO and how they've made it a different size, and they've done all kinds of things to our wheat. So all of that can affect our DNA and our health. Black cohosh is another herb that can be very helpful. And then to avoid hot flash triggering foods, if you're going through hot flashes, things that could make it worse might be caffeine, alcohol, or sugary or spicy foods. So that's kind of something that you'll each figure out as you go through it. Yeah, it is interesting. You'll figure that out as you go through it. So for me, if I had a cup of coffee, I might have a hot flash. If I ate spicy food or had a glass of wine, particularly red wine for me, would throw me into a hot flash. So you'll figure all that out.
Are they only doing peri, or when you're done, or you're in menopause, you still get them?
Yeah.
Oh.
Okay, I'll tell you this. I don't get them very much anymore, but I haven't had a period in 17 years. So I had them for a long time. I had them, I think, on and off for like 10 years. It was ridiculous. Again, I didn't know everything that I know now. I think I would handle it differently now. I would get different care. I would probably do what I now do to balance things instead. And maybe that's why they stopped, because I started taking the supplements that I needed to balance my own hormones. Yeah. The proteins are really important, and you want to get the best quality you can. The best quality animal protein, beef, chicken, fish, turkey, etc. Eggs, if you can tolerate those things, are good for people. Now, some people do choose to not eat meat or animal products, and if they choose to do that, then they have to get their protein through different sources. They also need to take vitamin B12 because they're not getting any foods at all that are giving them B12. So it's very important to know that if you give up a certain food group, how are you going to then get the nutrients that are required from that? And there are ways, there are very good protein powders that are, some protein powders turn to sugar in the body, so you might only use, I heard this number, 16% of something, and the rest of it turns into sugar that the liver then has to process. And the liver's trying to process hormones, so it doesn't need all that sugar. But there are also very good amino acid supplements if you get the whole amino acids. And if you're interested in that, I'd be happy to give you some referrals for that and tell you what I use. Don't drink fruit juice. Fruit juice is pure sugar. What is insulin resistance and how is it related to hormones? I think I addressed that, right? I addressed that. So insulin resistance, meaning the body cells don't know what to do with the insulin, and that whole process of sugar and insulin gets out of balance. So insulin is a hormone, and you need good thyroid hormone, you need a good liver, you need a good pancreas, you need a good system in order to avoid insulin resistance. Now, hormone cream, somebody asked, was how much should a person use and is it worth the expense? It is actually the same kind of thing as hormone replacement. Everybody's different. I can't answer that question. And I don't love the idea of using that because some people, they just sell it and somebody doesn't know how much to use or if that's a good product. So they just use it and then some other hormone could go out of balance. Anytime you give the body one hormone, this is a very delicate system. It's a very delicate system. So if you ever get one hormone, let's say you took too much thyroid hormone. That's going to throw the pituitary off. It's going to throw the liver off. It's going to throw the pancreas and the adrenals off. So you need to have that in balance. And when I say it's going to throw the organ off, it means it's going to throw off balance what that organ is supposed to do. So everything affects everything. Again, I think I covered this. What should postmenopausal women consider about hormones and hormone replacement? Handle it naturally if you possibly can. And know that if you start taking hormone replacement therapy, you will feel great for a few months. And then your system will go all out of balance and you could feel horrible. And it's hard to recover from that because now the body's used to taking something that it didn't have to make. That's why I was saying in the beginning that I've been taking thyroid replacement hormone for 30-some years. So my thyroid probably doesn't even know how to do it anymore. How do adrenals and thyroid interact with hormones? I think I handled that, right? Good. How triggers can be so much worse when you're under physiological stress. When we're under stress, anything can be worse. So you're driving along on the highway and you're under stress, you're hurrying to get to work, or you're under stress. Something might have happened that was upsetting you. Phone call you had with somebody that now you're upset. So all of a sudden, everybody on the road is more of an idiot than they used to be. So you might get really angry with people on the road. Whereas if you were really happy and you just had a nice walk and you had a lovely meal and it was healthy for you and you had a phone conversation with your best friend and it was all lovely, you get on the road, go, yeah, sure, go ahead. You must be in a hurry, right? It's a completely different thing. So how does that affect your physiology? Your physiology being how does your body work? A few ways. Anything that is off balance can be worse. You could get a headache. You could get a stomach ache. You could not digest your food well. Your heart might palpitate. So you can see that stress does affect the physiology. One thing I know now is that stress from the past can affect us in the present, and we might not even know it. For instance, have you ever seen a person that you've never seen before and you hate them, but you don't know that they remind you of your mean third grade teacher? You don't even remember that. But there it is, and all of a sudden there's this person who might be a perfectly fine person. You have no idea who they are, but you have a judgment about them based on your past. Let's say you had a situation where you were bullied at school when you were a little kid, and now in this day and age, whenever you feel criticized, you want to go hide, and you can't have a conversation with anybody. Those are the ways that the physiology remembers, the body remembers, and it can affect your life. Therefore, it can affect your health throughout your life unless it's handled. I'm mentioning this because I now know, because I'm getting certified in an amazing technique called neuro-emotional technique. We can get to those things and just kind of cut the cord immediately, and it's gone. You don't even have to think about it. It's not like re-traumatizing yourself through therapy. Therapy can be extremely useful, and it can also be re-traumatizing, in my opinion. It's certainly very useful sometimes. And if we can go through thinking through our reasons and our problems and our stresses and or cut off the triggers, then we can be more current within ourselves at any moment, and we can be more ourselves. Because we were born to be ourselves, and there was no trauma there until there was trauma. And then we interpreted that trauma and made it true without even knowing it. So this is a goal of mine in my practice with patients, to be able to have everybody be their true self and their happy self. So that's a cool thing, and I would be, any of the things that I've talked about, I'm happy to talk about.
So when you're in menopause,
Yeah.
do your hormones have to mess up or
No.
not work? Oh,
No,
okay.
they don't.
Okay.
There are people who've really lived very healthy lives who have no problem going through menopause at all. Like there are people who just kind of didn't even really know what happened, and they went on and they stopped having periods and they just kept going on. And that's the ideal. That's the way it should be.
I know it had to do with the ovaries. So
Okay.
I think when you said the ovaries shrivel up, I think I was thinking that ovaries kind of control the hormones, but they just
Yes.
release the egg, right?
No, they do. They do have something to do with creating estrogen.
So
They do. So that is part of the reason. That's a great question. That's a really great question. So when after menopause, the body is making less estrogen. Yeah. So it's important to, it can go on less estrogen. It doesn't need a whole lot of estrogen. In not too long ago, everybody who started ever having hot flash got estrogen.
Mm.
And then a lot of women got breast cancer. So they stopped doing that routinely. So there are some people who do okay with getting estrogen. Some people actually do okay with getting hormone replacement. But not like it used to be. It used to be routine. Then menopause happens, you need estrogen. Because that was the answer to bone density loss. It was the answer to hot flashes, to the symptoms of menopause. So, what a great question. Thank you.
Can I offer something for
Of course.
for hot flash people? So, as a massage therapist and an essential oil person as well, what helped me go through all of this during hot flash moment was, and I suggest this to my clients, is you put peppermint oil around your ankle bone, where your ovaries are, and so
The
do that
reflex
before
for
you
the
go.
ovaries, yeah.
Reflex, yeah. So you do that before you go to bed.
Thank you. That's that's good.
It's a good quality essential oil. Okay.
Yes.
Okay, all right, I'm not done. Okay, so if you have, let's call it cramps or menopause, hormonal imbalance, okay? There's okay. Hormonal imbalance. We've got nutrition. We've got structure. So we want to have our nutrition in order to have this be balanced instead of imbalanced. We want to improve our nutrition and improve our structure, meaning as a chiropractor, the nervous system flows through the spine. So we've got a brain, we've got a spinal cord. And if there's interference there, that interference can affect the organs of the body. So the structure is very important to keep our nervous system free. And our nutrition is super important, which we've already talked about. So these three have to go together in order to have balance.
Can I ask a real quick question that reminded me? When my sister who's a year older than me, when she was young and she got her period, like in the very beginning, she got it really early too. She would be on the couch in such pain. She couldn't even function. She couldn't even move in a fetal position. It was really horrible. Then there was me, who I didn't even know I was getting my period until my lower back hurt. That was my sign. My lower back hurt. Oh, I must be getting my period. Was that an incredible imbalance in your little triangle there for my sister? Back in the day, she never even structure.
Probably.
Yeah.
Probably. I mean, I don't know what your family ate. I don't know
Yeah.
what each person's activity level was, what your stress levels were. Those kinds of things could impact it as well. But the structure, I mean, I have a lot of women who come in to me as a chiropractor, and they might be in the midst of having horrible cramps, and I, from the outside, lift their uterus, adjust their lower back, and the cramps go away.
Oh. Wow.
So keeping that and keeping the spine and the pelvis in alignment is really helpful. If you are not yet a patient here, if you wouldn't mind getting on the list up front, so if you'd like to be on my very infrequent email list. And that way we can communicate. You can feel free to connect with us, whether or not you become a patient. You can always text us, and I'm just a real person. Like, I can talk to you. So.